Citralka, uses, dosage, side effects, and precautions. Citralka syrup is a commonly recommended urine alkalizer that helps manage several urinary disorders, including kidney stones, urinary tract infections, UTIs, and gout. By increasing the pH of urine, it reduces acidity and prevents the formation of uric acid crystals. This makes Citralka effective in easing pain, irritation during urination, and reducing the recurrence of stones. It contains disodium hydrogen citrate as its key ingredient and can be taken with or without food for optimal comfort. What is Citralka? Citralka Liquid is used to treat gout and kidney stones. It inhibits the production of uric acid in the body, reducing gout attacks and preventing kidney stones. Citralka Liquid is suitable for use with or without food. This will help you from not getting a stomach ache. Take it on a regular basis and do not stop taking it even if you feel better until your doctor says it is safe to do so. What are the benefits and uses of Citralka? Citralka syrup offers multiple therapeutic benefits for patients suffering from various urological conditions. The primary mechanism involves alkalinizing the urine, which creates an environment less favorable for stone formation and bacterial growth. Conditions Citralka treats. 1. Stones in the kidney. This medication is used to treat kidney stones caused by uric acid or calcium oxalate. It is also used to dissolve kidney stones in patients suffering from renal tubular acidosis, a condition in which the kidneys fail to remove acids from the urine. 2. Alkalinization of urine. This medication is used to increase the excretion of toxic substances from kidneys by alkalinizing the urine. 3. Infection of the urinary tract. This medication increases the alkalinity of the urine, which inhibits bacterial growth and alleviates the discomfort caused by urinary tract infections. 4. Micturition. This medication aids in the relief of painful or difficult urination. How does Citralka work? Citralka works through a sophisticated mechanism involving bicarbonate metabolism. Once ingested, disodium hydrogen citrate is metabolized to bicarbonate in the body. This bicarbonate then increases urinary pH by promoting the excretion of free bicarbonate ions, effectively alkalinizing the urine. The alkalinization process increases the solubility of cysteine in urine and promotes the ionization of uric acid to more soluble urate ions. This mechanism prevents the precipitation of these substances as crystals or stones. The medication typically begins working within 1 minute of administration, with effects lasting 4 to 6 hours. Citralka syrup dosage. The dosage of Citralka, disodium hydrogen citrate, varies depending on the patient's age, medical condition, and the severity of symptoms. Here are the general dosage guidelines. Typical dosage for adults. Standard dose, 2 teaspoons, 10 milliliters, diluted in a glass of water. Frequency, taken 3 to 4 times daily. Administration, should be taken after meals to minimize the risk of stomach upset. It is important to drink plenty of water while taking Citralka. Dosage for children. Standard dose, 1 teaspoon, 5 milliliters, diluted in a glass of water. Frequency, taken 3 to 4 times daily. Administration, should be taken after meals, and ensure adequate fluid intake. What happens if an overdose? Symptoms of overdose. Overdose symptoms may include difficulty breathing, confusion, muscle twitching, increased thirst, electrolyte disturbances, nausea, and metabolic alkalosis. What to avoid: never exceed the prescribed dosage. If overdose occurs, seek immediate medical attention, especially if experiencing serious symptoms like breathing difficulties. What should I do if I miss a dose? If you forget to take any dose or by mistake miss a dose, take it as soon as you recall it. If it is already the time for the next dose, skip the forgotten dose. Take your next medicine at the regular time schedule. Do not double the dose. Citralka side effects. While Citralka is generally well tolerated, it can cause various side effects ranging from mild to severe. Most side effects are temporary and resolve as the body adjusts to the medication. Diarrhea, nausea, vomiting, tiredness, weakness, drowsiness, frequent urge to urinate, unpleasant taste, stomach cramps, flatulence, change in mood, serious but rare side effects. Severe but uncommon side effects include hypokalemia, metabolic alkalosis, mood changes, shortness of breath, muscle weakness, irregular heartbeat, and gastrointestinal ulceration. These typically occur with excessive doses or in patients with impaired renal function. Important: if any side effects persist, worsen, or if you experience severe symptoms, consult your doctor immediately. Your healthcare provider may adjust the dosage or prescribe alternative treatments to manage side effects effectively. Precautions while taking Citralka. Use this medicine cautiously in patients with stomach disorders, liver impairment, or acute dehydration, as it may worsen their condition. Close monitoring and possible dose adjustments or alternative treatments may be necessary. Avoid use in pregnant or nursing women unless absolutely necessary. Consult your doctor before use. Are there any age restrictions for using Citralka syrup? Citralka syrup can be used in children aged 6 years and above under medical supervision. Always consult a pediatrician before administering this medication to children. Alcohol or food interactions. There are no known interactions between Citralka syrup and alcohol. However, it's advisable to consult your doctor regarding alcohol consumption while on this medication. Taking the syrup after meals can help minimize stomach-related side effects. Possible interactions with other medications. Citralka can interact with various medications, potentially altering their effectiveness or increasing the risk of adverse effects. Drug interactions overview. Citralka enhances the elimination of salicylates and barbiturates while potentially increasing the half-life of quinidine, ephedrine, and pseudoephedrine. It may have additive effects with sodium retention caused by corticosteroids and can potentiate renal excretion of tetracycline. Impact on supplements and herbal products. The medication may affect the absorption and effectiveness of certain supplements and herbal products. It's particularly important to monitor interactions with potassium-depleting diuretics, which may lead to hypochloremic alkalosis. Always inform your healthcare provider about all medications, supplements, and herbal products you're taking before starting Citralka treatment. How should Citralka be stored? Proper storage is essential to maintain the medication's potency and prevent degradation. Storage guidelines. Citralka should be stored protected from light and excessive heat. The medication should be kept at room temperature between 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. Recommended storage temperature for Citralka. Store the syrup in a cool, dry place away from direct sunlight and moisture. Ensure the bottle is tightly closed when not in use to prevent contamination and maintain drug stability. What happens if Citralka is not stored properly? Improper storage may lead to medication degradation, reducing its effectiveness or potentially causing harmful effects. The medicine has a shelf life of 24 months when stored correctly. Important information. To avoid stomach upset, take Citralka Liquid after meals with a glass of water or fruit juice. To reap the most benefits, continue to take it as directed by your doctor. While taking this medication, you may experience stomach pain. If it bothers you, notify your doctor. Keep away from children. Always store Citralka out of reach and sight of children and pets to prevent accidental ingestion. Do not use the medication beyond its expiration date, and dispose of expired medication properly according to local guidelines.